Okay, so today we're going to go over what are the components of the digital implant kit. So each suite has a kit, and this one's suite B, and this is the digital implant kit. So we're going to go through each component. Essentially, this kit is set up for you to go through and train yourself how to use some of the components for restoring implants at the lab or even chairside. So I'm going to go through the parts in this quick video just so you know what's in them. So in each kit, and here's a kit right there, we'll have it marked with it saying digital, and then I'll actually have a written version of this so you guys can follow along on the written version if you like that. So in the kit are two models. One model is an upper and a lower, and then we're restoring tooth number 5. As you can see, this is a real case that was done in the clinic, and you can see that there's 2 premolars and this is a 3rd premolar, and that's because the space at where this tooth was not enough. So it's something you can just kind of evaluate, but this is an actual case that was done here in the clinic. So inside the kit we got 2 models, okay, and then we're going to take out a couple things here. So the next thing is a driver. This is a restorative driver, and again for a DO kit. So, and then again, this is going to be for DO, what we do here in the clinic, but this can be used pretty much, the components are interchangeable for many systems on the market. So what you learn on the DO, you just have to know, the same components for the company that you're working with. So the first thing you see is number 1 here, and this is going to be a lab analog. The lab analog is essentially the replication of the implant in the patient's mouth. So when we take scans and we send it to the lab, and with these components, they make a 3-dimensional model. They place this lab analog in, and this is what is the basis for them making the abutment in the crown. So we're going to do the same thing. So we're going to treat this like the patient's walking in with that, but that's the lab analog, and that goes in there. Okay, the next thing we see here is a healing abutment. So obviously the patient comes in to do these things, then they'll be wearing a healing abutment. So that number 3 is a healing abutment, and that will be in the model. Let's see here. Next thing, I skipped over number 2, which is a hand driver. So it's how to put the components in with a hand driver, and then also when we actually use the torque wrench. And the next thing is, this is number 6. This is a tie base with a screw, and we're going to go over how to use a tie base on a video that's coming up. And then this guy right here is a scan adapter. That's what DO calls it. This is also aka known as a scan body. This is the component that we send to the lab when we're doing restorations, say with DO or any implant company, and we're going to be sending things off to the lab. So that is a scan adapter or scan post. So that is also called a digital impression post. And then the last thing in there would be, this is a digital scan post and a digital scan body. This is for restoring implants chairside using CEREC. So if we're going to use CEREC and we're going to design a crown in the CEREC system to be sat on this tie base, these two go together, and there's a video for that coming up in this kit presentation. So these are all the components that are going to be in your kit for restoring an implant here at Midwestern University, whether it's going to be sent off to the lab with a scan post, or you're going to do it chairside with a scan post and scan adapter. So if you have any questions on the components, come see me or talk to your faculty. But we're in the next videos, we're going to go over how to do each step with each component. Again, if you have any questions, come see me.